Hi everyone, this is Shalu Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMCE OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. So welcome back to my another video for your adult NMCE OSCE exam. So if you like my videos and my YouTube channel, please press the like button now and subscribe to my channel. Like I said, it gives me a lot of motivation to keep making more videos for you, which hopefully looking at your comments are helping you in revision of your OSCE exam, and that is my aim. Okay, so please press the like button now and subscribe. Okay, so we're going to talk about another topic today in your adult NMCE OSCE exam, and I am going to talk you through the five most common fails in your planning station, because planning station is quite frequently failed. It's a written station. It's quite challenging because of the time limit and also the way you need to write in your care plans. So it can be quite challenging to pass, and it has been quite common station people fail in your API part of the exam. So we're going to look at what have been the 5 most common fails over last 6-8 months and how we can rectify those problems. Okay, so how can you stay safe and not make those mistakes or critical fails in your exam? So let's get started. Okay, so the first one, and I already told you, is 14-minute station. Is a written station. You need to write 2 very clear individual care plans for your patient, okay, and plan their care. So let's talk about the first one. So what is the first most common fail? I put a first because this is the top fail. Fail to choose 2 relevant nursing needs. Okay, so why is it the most common fail in this station? Because has to be, it's a critical thing that your nursing needs, what you have chosen to write 2 care plans are relevant and significant problems for your patient. So if you choose to write on pain, and pain is not a relevant problem for your patient, or when you did the admission they are not insignificant pain, so then examiner will fail you because that is not the relevant problem for your patient at the moment. So it's not significant problem for your patient at the moment. So or you choose a nursing need which is just you think that could happen, but that's not probably likely to happen. So sometimes people just overthink and choose a nursing need like, you know, dehydration. They are automatically assuming the patient may be dehydrated because they've got a bit of nausea due to subdural hematoma. Now that's a long way assumption. Okay, so is your patient okay, your patient has nausea at the moment, but is it gonna definitely lead to a severe dehydration? No. So why are you choosing that as a nursing need? So why don't you simply choose for subdural hematoma? Your patient may be confused. Why choosing confusion? Why choosing that they have a worsening headache? So think about, you could choose nausea, that would be fine, but then to say patient is experiencing dehydration or anything like that, that is just an assumption. So that is not factual. That's not what your patient present condition is. So that would be a fail. Don't choose anything which is not relevant. So how can you stay safe in this? So as you can see, look at your presenting symptoms. So they give you have already done the assessment station on this patient, so you already know what kind of nursing needs you discussed with the patient in your holistic assessment part of the assessment station, because in assessment station you took their vitals, you did their A to E assessment, then you went into holistic assessment talking about their nursing needs. So you already should know by this stage what are the 2 main needs for your patient. Second thing, so I am saying time, so go back to your assessment station, think about it. Another thing is they give you the patient history form back. So they're not asking to write care plans without giving you patient history back. So you already have the patient history form back in your hand. So look at the presenting symptom. Okay, so presenting symptom could be your first nursing need. So if somebody's come with shortness of breath, of course you're going to write a shortness of breath care plan. If somebody's come with acute pain, of course you're going to write acute pain care plan. If somebody is having elective surgery, then you will be writing, by the time they come to your planning station, then they will be post-op. So you will be writing post-op care plans on maybe post-op pain, post-op risk of developing wound infection. So if your patient is like subdural hematoma, come in with worsening headache, that's the presenting symptom, and nausea, so that could be your nursing needs. So, or confusion in subdural hematoma. So Alzheimer's, let's say for example, so your presenting symptom is the patient is experiencing worsening memory loss and confusion due to progression of Alzheimer's. So your nursing need is already there. Okay, so presenting symptom always give you a clue about your first nursing need anyway. So please look at it, and it's normally the first line or two in under your presenting complaint section on your patient history form. So use the patient history form carefully and read the presenting complaint section. Okay, so as you can see on my screen, as I am reading it, before I just start doing my care plans, I have put 1 and 2 on the screen, because that's my way of keeping clear in my head that first nursing need I'm going to talk about is the shortness of breath, because that's patient presenting symptom and the most important need at the moment. And the second one I have chosen to be the maybe risk of developing malnutrition, because my patient is not having patient is experiencing reduced oral intake over last 10 days, as you can see on the screen. Now I've highlighted mobility, reduced mobility due to exhaustion caused by the shortness of breath. So that is third valid nursing need. So I could choose any 2 out of the 3, but I put number 1 and number 2 because I'm clear in my head now. First care plan will be on shortness of breath, second care plan will be on risk of developing malnutrition. So that's how clear you need to be in your head, and checking it against your form that you're not making any mistake. Okay, so form will keep you safe because look into patient presenting complaints, and you already done the assessment station. So think back to assessment station what you discussed with your patient. So those are the top tips I can give you to make sure that you do not choose anything which is not relevant for your patient. So we already talked about different scenarios here. So in community you have a patient who's got leg ulcer or foot ulcer, so and they're having pain and they're having problem in mobilizing. So there you go, you already have 2 nursing needs which are relevant. Your diabetic patient, you think about is it unstable blood glucose levels, so you could write on that. You could write on is that affecting their sleep because they got frequency of urination because they're diabetic. Think into that. Has anything else been given in your presenting complaint, because they might be struggling with mobility, they might have increased risk of developing urinary tract infection. So there's lots you can think about. It's already given to you, so you don't have to automatically think out of nowhere. It is there, but you need to use it. Okay, so it's given on your patient history form. So use that information and don't try to come to conclusions which are indirect and you're assuming things that might happen and that might happen, but think about the things which are already happening to your patient. So that's, you need to write care plans on the current things. Okay, you could think about the risk of developing malnutrition or think of risk of developing urinary tract infection for a diabetic patient, which are very relevant. Okay, but don't overthink and assume things that somebody who's come with nausea will definitely have at the moment is experiencing dehydration. Now that is just an assumption. Okay, so don't do that. No assumptions, just stick with what's been given to you on the patient history form. That's the first thing. So make sure you do that, because this is a very common fail. Next one is fail to write to clear aim of care, the aim of care. Okay, so yes, so that's the next thing which brings us to aim of care, which is has to be related to your nursing need. And aim of care is always what you're trying to achieve, not how. Okay, because how is the intervention. So your interventions are written in a nursing intervention section of the care plan. Here you are just simply writing what is your aim of care. So it has to be directly related to your nursing need. It means if you are saying your patient is experiencing shortness of breath, it should be brief, very simple. Your aim should be to reduce shortness of breath and achieve normal respiratory rate. If your patient is at risk of developing malnutrition due to reduced oral intake, your aim should be to prevent malnutrition by increasing oral intake. So don't make it too complicated, okay? Simple words, don't make it too complicated. Don't start writing all the interventions in there, which I do see sometime when I mark care plans, but it's not. It's just it's simple, okay? So it's simple. Keep it simple and think about what you're trying to achieve, not how are the interventions. Number 3, fail to make corrections as per NMC guidance. Now there has been a very common fail, because think about it, patient notes are a legal document, so whatever you correct, you need to use NMC guidance, which I'm showing you on the screen, which is the single strike and your initials on the top. You don't write the correct word on the top, you don't superimpose, you don't do more than single strike, they will all be critical fails. So that has been a very common reason for fail in this station, because it's a written station and your patient documentation, it has to be legible. Any corrections you make have to be legible, so it's a single strike and your initials on the top. Tip number 4, fail to sign at name and date. Now if your document is not signed, who is written that care plan, it would be a complete fail, okay? It's a critical fail, because if your documentation is not signed in patient notes, there is no proof that you have written it. So that's the principle of it. So make sure, tip will be to add the details to both pages as soon as the timer starts. Make sure you do that first and then start writing your care plans. So that's that. Number 5, fail to write 2 complete care plans. So that comes the time management. Now that has been a very common fail, like I already said to you. Time is tight of 14 minutes to write 2 care plans is quite challenging. Mainly because we are not used to writing these days. We are either typing on our laptops or phones, even in some of the clinical practice, everything most of the time is online notes, so you're just typing into your system. So that's the reason. So for you need to write them with hand in exam. So please practice using a timer, okay? You need to be confident that I have the speed and legibility. So sometimes you get the speed, but then nobody can read your handwriting. That's no very good plan, okay? So you got to be having both. You got to have the speed and you got to have the clarity at the same time. So that will need a lot of practice. So don't think it's a written station. As long as I know what I'm writing, I will be fine. I write an exam. No, it needs a practice with a timer, and pass your handwriting to somebody to check that they can read it. So that's the other thing. You need to make sure you still have the clarity, and you're making the corrections as per NMC guidance, because you're bound to make some mistakes in writing when you're writing quickly. So give it to other person to check, have I corrected it correctly, can you read my handwriting? So that's really important. And divide time equally between the 2 care plans. What happens is, we'll see the care plans. One is written beautifully, okay, and I will see in mock exams as well when I do. One is written beautifully with so many interventions, is absolutely a complete care plan, more than complete probably, but the other one 4 lines. Okay, so that's not a good exam technique. So make sure you are keeping an eye on the timer and thinking, I've got 7 minutes to complete this, 7 minutes to complete the next one. So you keep looking at your timer, which is very visible on your desk when you are in exam. So make sure you keep an eye on your timer and force yourself not to go too above the board with the first one and not complete the second one, okay? So complete the first one in the time slot and then move on to the second one. Or you can try to write first nursing need, second nursing need, first aim of care, second aim of care, and try to force yourself to divide your time equally between the 2 care plans. That's your technique, how you do it, that's up to you. But keep an eye on that timer and make sure you don't go way above the board with the first one and then not leave yourself enough time for the second one. So that's really important. So I hope you got these now, and I hope you are not gonna make these mistakes, and this video will help you. So if you like this video, please press the like button now and subscribe to my channel. And also you can visit us on OSCEnursetraining.com and email us on OSCEnursetraining@outlook.com. We provide both online and face-to-face training for your OSCE exam. And keep coming those reviews on our Google page, which are great. So you can go and check out what nurses have to say about our training. So I will soon be back with another video for you. So bye for now.